This is Frequently Asked Questions About Natural Migraine Relief for Women, episode 23. What is the relationship between anemia and migraine? This is Jeff Baker, your physician host for Frequently Asked Questions About Natural Migraine Relief for Women. I recently had an office follow up for a patient who was an excellent illustration of the condition we'll discuss today. She had several cofactors promoting her migraines, and anemia was one of the most prominent. With a roughly 20% improvement in both blood count and iron stores over the last 3 or 4 months, her migraines this last month have backed down significantly in both intensity and frequency. So far, so good. We're also expecting more daytime stamina and exercise tolerance for her in the weeks ahead. In the US, somewhere between 30 to 40% of women under 50 are iron deficient and 10 to 15% are clinically anemic. It's interesting to note that in the same age group of males, anemia is one half to one third this level at 5% incidence. And we do know that women experience migraines at roughly 3 times the incidence of men. Coincidence? Or maybe some causal connection? Let's investigate further. Anemia occurs when the volume of red blood cells is low. It is often related to iron deficiency, which can occur with or without anemia. Headaches in general, and specifically migraines, are more common in those with iron deficiency or anemia, and several studies show that people with iron deficiency anemia have a higher rate of migraine. Some of these studies that showed this connection include a 2022 study that estimated that nearly 80% of people with iron deficiency anemia also experienced headaches. Additional studies connecting anemia to migraine include a study from 2022 showing that 23.3% of people with migraine also had anemia. Another study compared rates of iron deficiency anemia in people with and without migraine. In the migraine group, 21% of people had iron deficiency. Among the control group, those without migraine, only 10% had iron deficiency. Another study showed a connection between ferritin levels and migraine. Ferritin is a measure of iron stores in the body, and in women under 50, those with low ferritin levels were more likely to experience migraine. And then a randomized controlled study from 2020 showed that people with anemia who supplemented with iron reported a significant improvement in their headaches. There are several reasons that anemia or iron deficiency could be promoting factors for migraines. One would be that a reduced red cell mass and low hemoglobin means lower oxygen carrying capacity. And as the brain has a high second to second oxygen demand, a low grade but chronic underdelivery of oxygen could diminish brain energy production and repair capacity. I talk a lot in these FAQs about additive root cause factors that underlie the expression of migraine headaches. This certainly can be one of those root causes. Another reason could be that iron is a cofactor in the enzyme pathway that makes serotonin, which is a key chemical messenger in the brain. As reductions in serotonin have been associated with migraine headaches, this could be a contributing factor for those with anemia. And then, as well, iron is used in multiple other energy producing physiological processes, such as oxidative phosphorylation, mitochondrial function, and ATP production. This may explain, as we'll talk about further, why there is such variation in symptoms found in anemia. So, why are women more prone to anemia than men? The main reason would be loss of blood through monthly menses. After menopause, the rate of iron deficiency goes down significantly. Pregnancy and lactation can also draw down iron reserves, and many women eat less red meat or other iron rich foods than do males. We should note that after menopause, women may accumulate iron and at some point could have excessive iron and some exposure to the same iron excess symptoms that cause men to have more vascular plaque events than women do in their 50s and 60s. Symptoms of anemia can include fatigue, difficulty concentrating, weakness, shortness of breath, a fast or irregular heartbeat, feeling lightheaded or dizzy, skin that is paler than usual, and headaches, including migraines. Some of the most common causes of anemia and iron deficiency include low dietary iron intake, higher iron needs due to growth, pregnancy, or other health conditions, iron loss due to bleeding, especially heavy or prolonged menstrual periods, and poor absorption of iron due to a gastrointestinal condition or kidney disease. Now let's review the evaluation and diagnosis of anemia. The simplest start for those with symptoms suggestive of anemia would be to test for one, a CBC to look at the total red cell count as well as the red cell size and iron content, and number two, a serum ferritin level for iron stores. There are other tests to consider and a check with your personal physician to discuss your headaches, potential anemia symptoms, and blood up workup would be recommended. If you want to get ahead of this process, you can get some tests done initially direct to consumer at locations like lifeextension.com. On that page, you would click the lab testing tab and pick the complete blood count, around $35, and a ferritin level for around 28. Generally, they have this done at a local LabCorp office, and you can see the details on the Life Extension website. There is also a correlation between migraine and the problem called restless leg syndrome. and also between restless leg syndrome and iron deficiency. If you either have migraines with RLS or RLS alone, it would be advisable to check for both ferritin levels and anemia. Treatments for anemia and iron deficiency for migraine patients include: one, dietary changes. A person may focus on getting more iron sources in their diet. Some good sources include meat, chicken, fish, nuts, seeds, eggs, and beans. And also to make sure that you get enough iron by possibly even taking an oral supplement. These come in several forms. One of the easiest for self-care is a typical prenatal vitamin found at any drugstore. These have iron along with support B vitamins to enhance the bone marrow production of red cells. You may also want to consider taking a vitamin C dose of 500 milligrams at the same time, as it will significantly increase the iron absorption. The vitamin C can also help to take the edge off the potential tendency for constipation that you can get with oral iron supplementation. Another factor of potential importance is to manage estrogen dominance issues. This is particularly if you're premenopausal and are prone to heavy periods, and especially if you have late cycle PMS symptoms that suggest that estrogen is having undue influence on the amount of menstrual blood lost each month. Taking progesterone daily or specific additional amounts during the latter 4 to 7 days of the cycle before the period begins may help to lessen the volume of monthly blood loss. Treatments for iron deficiency anemia help to stabilize iron levels so the body can: one, build normal amounts of red blood cells to deliver optimal oxygen supplies to the brain, and two, have the iron facilitate the optimal enzyme production of brain serotonin as well as important energy substrates. These measures to correct iron deficiency or anemia, or more likely in concert with the correction of other migraine root cause factors, could help you to ease or clear your migraines. The correction of iron deficiency and related anemia is only one of 90 non-drug therapy options I found useful for migraine headaches. If you would like to understand the broader range of root cause factors that drive your migraines and then go on to individualize the many possible therapy options, you should take a look at my comprehensive Natural Migraine Relief for Women course and its unique migraine action plan system. See naturalmigrainerelief.online for more details. And also remember to subscribe to this YouTube video and my Substack blog to get regular postings on frequently asked questions about natural migraine relief for women. If you'd like to do further research, here are the references that we mentioned in this episode.